As we all know, the right to health care has no legal obligation, yet there are legal remedies when health care errors occur. A moral obligation exists and is aligned in any healthcare organization. Today, we are here to discuss this alignment and the path we will achieve it. When we ask the basic questions about the moral right to health care in terms of compliance as an organization, we come to certain conclusions. The who question refers to any being who requires care. The what refers to health care and the moral right. The where is the location of that health care, and the when refers to any time health care is warranted. Today, we're here to talk about the why and the how of the moral right to health care as an organization. So, without further ado, let's begin with the why of what the moral right to health care represents to an organization. The term moral right to health care in terms of compliance represents the why or the reason of any healthcare organization. One main reason is to further healthcare organizational goals such as providing and applying the best procedures for care to achieve best patient outcomes. Another is in regards to the Hippocratic Oath, which fosters the ethical principle of non-malevolence, which is the duty sworn to do no harm. So now that we've reviewed the reasoning of why, we will move on to the how of achieving this goal. So, in our how, we want to follow Code of Ethics guidelines. We want to use ethical resource allocation practices. And we also want to use effective cultural competency practices. And this is the outline of how achieving healthcare organization goals will work. Follow Code of Ethics guidelines and in relation, address compliance officer with questions and concerns, review risk assessment plan as required for needed information, employ the use of ethics committee to ensure equal distribution of resources, and preventive ethics. They say an ounce of prevention is worth a pound of cure. The concept behind PE is to prevent dilemmas that result from conflicts of interest and maintaining a professional demeanor throughout the process. Ethical resource allocation. When rationing resources, we must put the patients first in order of life and death situations, followed by elective procedures affecting the patient's quality of life. Cultural competency involves using educational materials such as language-oriented pamphlets and language assistance for patients. Training programs for staff on cultural differences are steadily becoming mandatory due to the fact that healthcare is a global effort as well as state to state. Practice ethical sensitivity involves respectfully seeking to identify and interact applicably to the concerns of those receiving health care and recognizing health differences in culture in order to provide the appropriate care. In summary, compliance in providing health care involves following the Code of Ethics guidelines, practicing ethical resource allocation, and the use of effective cultural competency practices. This concludes the presentation. Have a good day.